Oh, shit.
Thank you very much, everyone.
Oh, shit.
Thank you.
No rush.
Beautiful day in the Rose Garden.
Can you speak up?
Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking.
Does he have, is that mic on? Jesus Christ. Give me... Fucking Christ. Okay, all right, hold on. Let me manually fucking up the sound. Yay!
In our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible.
There's like one country that's done worse than us, and it's Italy, I think. I think basically every other country on Earth is doing a better job handling corona than us. And Iran? Oh yeah, Iran I heard is doing pretty poorly. Yeah, is he dying? Holy shit, he sounds like he's falling apart. England is bad. Japan might be doing badly. All right, okay. UK is doing bad. Okay, all right, never mind. America #1, I guess. Seriously, though, the idea that we're in, like, the top level of countries responding to this is fucking ridiculous. Vietnam did tremendously. China's done pretty well, all things considered, you know. South Korea? Oh, South Korea is doing really well. Why are all the Asian nations doing well? Whatever. I don't know. Whatever the case is, America, keep in mind, Trump fired before all of this. The United States Pandemic Response Team cut CDC funding, pretended that the coronavirus was a Democratic hoax, blamed the Democrats for overinflating the coronavirus, and then rather than putting money towards helping Americans survive the economic fallout from this crisis, he put 1.5 trillion into the economy, into the essentially to keep the stock market pumped up, and just instantly, it did nothing. It did nothing. Yeah, Vietnam is doing great.
A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now. And
he literally can't. It's an ego thing for him. He literally can't just say a thing without comparing it to another thing that he says are doing worse. Like, he can't do it. He can never say, you know, I like my shoes. He has to say, like, I've got good shoes. I know a guy. He has worse shoes. My shoes are better than his shoes. He's not capable. He has, like, the most fragile ego. I wonder why he sounds so low energy over here. I thought this was a high energy boy.
We closed that border a while ago. So that was lucky, or through talent or through luck. Call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days.
I'm going to let you guys know if he says anything of substance at any point. I'll let you know if at any point at all he says something that is new or informative. Destiny says this pretty often, but it remains equally true in spite of him having said it. When does Trump ever sound like he knows what he's talking about? Like, he never sounds even a little bit intelligent on any subject he speaks of. He never sounds like, like on nothing, not military, not the economy. He never sounds like he knows what he's talking about. He just sort of meanders through at like a 8th grade level, maybe not even that.
From entering the United States, citizens, permanent residents, and our families, any of the families returning from Europe will be subject to extra screening as well as self isolation for a period of
He talks monotone during subjects like this because I legitimately think his fucking room temperature IQ brain or his ailing, senile, dementia-riddled brain is incapable of inflecting while he's reading from a script. That's why he sounds so robotic when he has a script to read from, because it takes all of his brain just to process and regurgitate the words. It takes everything he's got, you know? He can't do any of his fun little speech things where he, times out sentences or leaves room for applause. He's so illiterate. He actually has to focus entirely on the words in front of him.
14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation.
Maybe Biden's senility isn't actually going to be that much of a problem for him in the election, because Trump is about as soup-brained as Biden. Just they're in different ways. Like both of their brains are rotting at different speeds, but I think to comparable extents. And they're funny, but they're funny in different ways. Trump has this big, MAGA rallies that he runs 24/7 for his ego boost, and Biden will call people dog-faced pony soldiers and then threaten to slap a voter. That's Trump would never do that. See, that's like a unique Biden thing. There's just such a wonderful character of dementia that that we see, unfurling here. Such diversity.
But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
I thought it was a Democratic
Two very
hoax.
big words. The
What?
action I am taking will open up access to up to $50 billion of very important and a large amount of money.
I can't. He's actually dying. He's very big. Which is money. Very big words. Can we get that again?
Freeing up access. Very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right.
Greatest retailers? Wait for your wait hand and knee on your update from Nordstrom. What? Ross Stores. Cold. Is everyone ready for the cold? Oh man, I'm sorry. I should be focusing on the coronavirus, but every time I listen to Trump speak, I am actually just buffeted with how bad it's gotten, like with how actually fucking stupid he is. I really should be focusing, but I can't.
Behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York.
What?
The emergency orders.
What does he say? states, they're engaged. One state was engaged. We talked about how he was engaged. Many states are engaged, including New York.
I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus.
What does that mean? What maximum flexibility? What the fuck does that actually mean, though? Maximum flexibility to respond? He said he gave like 50 billion to states, which is nothing. That's like a drop in the bucket. What the fuck does that mean?
And care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible. It gives remote doctors visits and
telehealth. They say it's a thing. Very tremendous telehealth. Very tremendous things being done in the not so recent past. Just refund the CDC, dude. What's the fucking budget for the CDC? Jesus Christ, dude. The CDC's budget is like $7 billion, with the $1.5 trillion that Trump pumped into the economy to pretend for 2 hours that the stock market plummet was stopped. He could have funded the CDC for the rest of the existence of the United States of America at 10 times its current budget. He could have just made 10 CDCs and had that be the case until the end of this civilization. But nope, instead we were all enjoying the red line go down, woo, and then it had one little bump up and then woo, keeps going down. That was what we traded that for. We could have had fucking 10 CDCs. We could have had all student debt removed. But now we have, woo, little, red line go down. Fucking kill me.
Hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements.
Trump's budget director stands to cut CDC by 15%. They're still doing it? These people want you to die. I keep saying it. They just want you to die. They just want you fucking dead. They just want you dead. In the middle of a pandemic. Just to save $1 billion. $1 billion. 1 single billion. Which, mind you, is a fraction of a single percentage point of the money that Trump used to float the stock market for 2 hours. Are you going to mention it was a loan that is going to be paid back? Yeah, of course the money that he put into the stock is a loan. Who the fuck cares? If we can print that much money to put into the stock market, we can put it towards things that will actually save the country, like funding the CDC. I would much rather have them print off 1.5 trillion and spend it permanently on the CDC and healthcare than have them print off 1.5 trillion to make red line go whoosh. They just want you to die. They just want you to fucking die, folks.
That critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission.
Why does he want budget cuts to the CDC? Because they want you to die. That's why. Because they want you to die. They want you dead.
To a nursing home, big thing. The authority to waive the rules to
Stop being hyperbolic. I'm not. Wait, Aurora, do you think that's hyperbolic? That with everything the Republican Party does that they don't want you to die? Because they hate you. Because it's in their class interest to maintain the suffering and misery of everyone in this country who isn't a part of the 1%. Because death and turmoil being raked amongst the lower classes is preferable to them than acknowledging that the state and state spending can do anything to improve the quality of life for the average American. Why the fuck do you think? Do you think Medicare for All would literally save us money? There is no explanation for the behavior of these people apart from suffering being a part of their class interest. At least tell us what their official motive is. Their official motive, I'm sure, is to cut down on government spending. The real reason is because they want you dead. They want you to die. That's why they do everything they do. That's why we don't negotiate fucking pharmaceutical costs with our pharmaceutical companies, with the government. That's why we let insurance companies dictate their plans based on your fucking job. That's the reason why we have the most inefficient healthcare system of the developed world, which makes billions of dollars for the people who are in charge of it. That's why we drum up pony stories so we can go to war with foreign countries and get thousands of our people killed, millions of theirs killed, and subject hundreds of thousands of our veterans to PTSD, which we then don't pay for them to address. They want you dead. It's not just they want more money than you. They want you to suffer. Read 1984. I hate to say it because it's cliche, read 1984, the surveillance state. But it's been a part of broader leftist theory for a while now that class distinction must be maintained not only through wealth, but also through suffering. It's not enough that they be wealthier than you. They have to be happier than you too. And by maintaining your suffering, your misery, and your death, they ensure a line that substantiates their social position over you. They want you to die. They want you dead. That's it. That's the only... Why do you think Trump fired the fucking pandemic team from this country? Do you have any idea how small and how well equipped that team was? This is literally just a small crack team of people whose job it is to prevent a pandemic. And what is this? A few $100,000 a year for the fucking United States of America? This is less than a fraction of what fucking Trump spends on golf every year. And we cut those jobs. They're just gone now. Why? It's because they want you to die. And any acknowledgement, any whatsoever, that the government spending can be used in a way to improve the livelihoods of the average person is a gateway to class consciousness. The average person must believe their entire lives that only the free market is capable of providing solutions to their suffering because the government would fuck it up. Because the moment you get these people to acknowledge the fact that it is actually government programs which are capable of helping the people, and that is that the Republicans are needlessly tearing these programs down, this is a recognition of class consciousness. They just want you dead. They want you to die. It's that simple. Also, creator phase. I'm well aware of the fact that the 1.5 trillion was a loan. That doesn't change the fact that the government is willing to spend trillions of dollars to prevent the higher level stock catastrophes, whereas the government will spend no money whatsoever actually preventing economic downturn by keeping afloat the average person. I don't give a fuck if they're going to make their money back. I don't give a fuck if Obama got his money back from the fucking the bank bailout and shit. The problem is that money is being spent there, that they're willing to make that printout there, but they will not even consider making broad top-down expenditures to alleviate other systemic crises. Pretty sure it was a negative interest loan. The specifics are, I imagine, fairly complicated, but that does not change the fundamental fact that these huge government expenditures are only made to mop up some sort of fuck up that's been done by the elites of this country, and are never made to actually help the common person. Also, it wasn't the government, it was the Federal Reserve. I know, okay, the Federal Reserve is part of the government. They're not elected officials, but they are part of the government. And the Federal Reserve is not completely independent from the from the interests of the common people. The Federal Reserve, if they wanted to, could work to pump money into other places that would more substantially help the common people. But they don't do that because they are beholden, broadly speaking, to it's a private bank. It's part of the government. Oh my God. Okay, there are a lot of people in chat who are trying to obfuscate obvious points with technicalities. The Federal Reserve is obviously a part of the fucking government. Just because it's not directly beholden to elected representatives doesn't mean, yeah, there are appointments, for God's sake. Yeah, who the fuck said it's not part of the government? All right, can we just...
hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established.
You know what's annoying to me? It's that Trump, if Trump wants to give us an incredibly specific breakdown of everything that he's doing, he should be specific. But if he wants to keep it simple and just leave the specifics to the actual medical care providers and otherwise just give a general, like, gist to everyone else, then he should just fucking do that. But he's doing this in between where he's being incredibly specific but incredibly vague at the same time. Just enough to be boring, but not enough to actually clue anyone listening in as to what specific provisions are being made.
Will remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things. As a result of that action,
fuck is he? Just say it. Just say
a
words.
New partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently. But we don't want people to take a test if we feel that they shouldn't be doing it.
What?
We don't want everyone running out and taking, only if you have certain symptoms. Using...
What? What's the point of a test if you only take it after you've developed enough symptoms to know what the answer is? The fuck are you talking about? Didn't Vietnam literally develop a test that could be done through a fucking scanner? Because there's some sort of buildup in your lungs that is associated with corona that they can test for? They can literally just scan you.
Federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with pharmacies and retailers to make drive-through tests available in the critical location.
I would bet any amount of money that we're not going to get that many tests out. I would guarantee any amount of money that that's not actually going to happen.
Patients identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to drive up and in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car.
Just
I
without-
want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether...
What? Is that an Obamacare website, Jab? From like fucking 1,000 years ago? That's a fucking Obama jab. He can't help himself. And Google, they're gonna make website much faster than the website. Terrible. Obamacare didn't even work. It's a fucking. He can't do it. He has to. He has to. Anytime he has to praise something, he has to find a way to think of some ego-driven
a
thing.
test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very...
By the way, it's very important to remember that everything he's advocating for, all of these, like we'll get the hospitals to do this or that, all of this is an attempt to temporarily override the neoliberal commercialization of our healthcare industry. All of this is because of austerity and big business that has made our hospitals just run on the thinnest possible margins to make sure they can make the most possible money off of human suffering. Whereas sometimes you have a pandemic and suddenly, need exceeds demand exceeds supply, except in any decent country, the supply of healthcare would always exceed the demand because you never know when you are suddenly going to need, a glut of beds or a tremendous amount of medicine or extra medical staff. We run everything on the thinnest margins, folks, the thinnest margins, all to the detriment when we actually, need these people.
Very strongly our country, stores in virtually every location. Google has
Buy one now.
1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass.
God, he's such a fucking idiot, dude. I understand what he's trying to say. What he's saying is, if you don't feel you have any symptoms, please do be cautious and don't just go ahead and get a test. We have a limited number of these and we want to make sure they go to the people who need them. But he's so fucking inarticulate. He can't even say that. We don't want everyone taking them. Don't go if you don't go, if you don't have the symptoms. He can't just the simplest reassurance from your leaders. He can't deliver even that. He doesn't have the words, folks. He doesn't know enough words.
Pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please.
What the fuck?
Thank you, Mr. President. It's a pleasure to be here with all.
Watch this woman unironically be leagues more charismatic than the President of the United States.
All of you. I think at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday,
I'm going to stand like Trump.
Around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp
Can you see it? You can't see it.
taking up the charge immediately after the
Look at him.
meeting and within
What's he doing?
72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California.
What the fuck is he
Washington,
doing?
Colorado.
What is he looking at her like that for?
Sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from
did you see that? Did you see how Pence nodded his head during that? Yeah, Pence, you want to have an opinion on the HIV/AIDS crisis? Look at him. He's like, oh, yes, true, that one.
I was part of the HIV/AIDS response in the 80s.
Yes.
We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy.
Yes, dead gay people, yes. Those were good times.
It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions.
AIDS crisis under Reagan. This bitch is a scumfuck. I don't know if no. This woman's a doctor. Reagan was at fault for the AIDS crisis. It's possible that she was just kept on a leash until it was time to actually, respond to the HIV crisis at the time. I don't know this person's political history. Who is this? Deborah Birx? Physician, diplomat, coronavirus response coordinator, has served as an ambassador for the Global AIDS Coordinator since 2014. Okay, so this is a recent thing. Then. Career, she was a physician in the Army, rising to the rank of colonel. That's pretty impressive, actually. Department of Defense, focusing on HIV/AIDS vaccine research. Assistant chief, hospital from 85 to 89. Director of the Military HIV Research Program at Walter Reed Army Institute. Until 2005. Then she served as the director of the CDC's Division of Global HIV/AIDS as part of the Center for Global Health. Okay, I think this woman's actually pretty on the ball here. Yeah, I think this is actually really good. Seems like she's basically just a medic who rose through the military ranks and has spent her entire life trying to contain pandemics. If you could describe HIV as a pandemic, I don't think it is, but it's, yes. With my high level of education, I've looked over this incredibly accomplished woman's receipts, and I suppose she's adequate to be giving this speech.
Solutions, but an automated, high-throughput system, bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3% and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1% and 2%. So we want to also announce this new approach to testing.
Oh, shit, she's got a chart.
The screening website.
Trump's like, ooh, I can understand this. He's like, oh shit, finally.
Site up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much. Correct.
The thing, if that is done properly, I think that's a really good response to the pandemic. That way we maximize the number of people who can get their tests, and we limit the actual social contact amongst people who need to get tested. It's a little unfortunate how corporate this is, but at the same time, that's probably been the case forever. I'm pretty sure, even back in the ye olden days, like the East India Partnership is proud to present, along with the Queen of Spain, our new solution to the bandit issues in the sea. You know what I mean? Like, corporations have been proposing solutions to public problems for a long time. I don't necessarily see a fundamental issue with this, apart from the existence of capitalism itself.
I'd like to maybe have Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony has been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience.
Did he even thank her for speaking?
And working well. I'd like to maybe have Tony, do you want to come up?
He didn't even thank her for speaking. Isn't that like customary?
I think everybody, I'd like.
Did he?
I'd like to maybe have Tony, do you want to come up? You've become
Did he just whispered it at her? He just quietly, so like the nation wouldn't hear? Okay.
Out here knows you, and you've Tony, please.
Thank you very much,
My
Mr.
man,
President.
all men are kings.
This is another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the president said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
I don't know how much I trust the medical, commitment of a person who sounds like he eats cigarettes as like a daytime snack. But all right.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers.
Jesus Christ. Okay. He should do. I would pay. You know what? I would not mind the disgustingly cynical fucking kowtowing to corporations. As fascists do, they work in tandem with the business. If he would just do like a jingle, you know what I mean? 500-988-2800 Empire Today or something like that. If he does a in accordance with Nordstrom Rack, I will now be performing a short. You're gonna love it, folks. When you need some clothes and you're feeling down. So, I just like, if we're all bitches of the establishment, then why not lean into it,
In the world, and one of them is Doug McMillan from Walmart, and I'd like
in association with Raid Shadow Legends. Folks, the coronavirus, it's very nasty. It's a very difficult problem to deal with, and it's not very fun. You know what is fun? I'm proud. He pulls out a second grader's styrofoam chart. I'm proud to present Raid Shadow Legends, which he's like drawn the logo on it. In Raid Shadow folks, there are so many characters. Look, this one right here. This one looks with the feathers, like Pocahontas. And this one it's a black. And this one, this one's got a big sword. Just folks, tremendous. Look at the honkers on this one. Just
If you would say a few words, wherever you may be, good, please.
When we got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the President described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you.
I can't believe this. I fucking can't believe this. Dude, if you gave a shit about coronavirus, you would let your fucking service workers go home, so it's not 100% guaranteed that they all get corona. My God, unironically, fucking 2020, dude, the president is giving a national emergency speech. Meanwhile, fucking the Nestle CEO walks up there, in accordance with the wishes of the president, we will now be publishing COVID-19 warning labels on all of our delicious bottles or delicious packages of Nestle chocolate milk, so even the children can understand what we need to do to move forward as a nation. Thank you very much. I'm voting for the coronavirus, okay?
I'll just stay right over here. And Richard, if you could come up, please. Richard, please.
What?
Walgreens, thank you.
Yeah, thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much.
He would look so much younger if he just shaved his head.
Brian Cornell, Target. Thank you, Brian. Thank you, please.
I just got this from Target this morning. Remember, folks? My Switch, my Animal Crossing Switch. Fuck, I gave this guy my money.
Mr. President, thank you for inviting us here today, along with our colleagues from Walmart.
Literally, this here's a national address. Can all the CEOs of fucking big businesses come over here to talk about... This is an ad. I'm gonna kill myself. This is so fucking bad, dude.
Walmart and Walgreens and our partners at CVS. Normally you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Poland? Tom Poland, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
Thank you very much, Tom. Great job you've done. Stephen Rakowski, Quest.
This is literally Hell World. If we just took to the streets right now and started rioting, it would be justified. This is Hell World. Are you fucking kidding me? All of these CEOs coming up here saying how dedicated they are to helping literally selling ad space during a national emergency news conference. And they're still having their workers work. They're still having all their fucking low-level service workers contract corona because nobody's being given any fucking time off.
Diagnostics, please. Great job. Thank you
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr. President.
Thank you very much. I appreciate it. Thanks. And Matt Sauce, please, of Roche. Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible, because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future, which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
And you can do it. You can do it. Great company. David Pierre
Great
of Signify.
company.
Signify Health, please. Thanks, David.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most
This is
vulnerable
just ad
elderly.
space.
And through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help. LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials.
All right. If nothing else, I have confirmed that the company that owns Raid's Shadow Legends has been left unaffected by this development. I am happy to confirm that the Australian company that owns the Israeli subsidiary that owns Raid Shadow Legends has not been affected, and apparently didn't exist before. Oh, here we go. Oh, wait, it's on a rebound. Oh, wait. Oh, shit, wait. What? Wait, really? The fucking Raid Shadow Legends company? Okay. Wait, don't worry, folks. It's gonna be on the rebound. Oh, man. Oh, jeez. Oh, God. Oh, no.
To make this work as well, and thank you, sir, for the honor.
Thank you very much. Thanks. Great job. And Bruce Greenstein, LHC Group. tremendously talented people. Thank you very much.
It's
Mr.
everyone.
President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of.
Oh, good news! Tencent, which owns League of Legends, is bouncing back pretty hard too. You know, not too much, not too bad. League of Legends is gonna be going for a long time, big long time, folks. See, barely a fluctuation. Corporate roll call? Yeah, dude, they have a fucking clown car just off frame with every CEO in the country just waiting to like come out.
Of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Good test.
We'll practice that.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today.
He's saying this, he's announcing this after corporate roll call. Afterwards. It's like 20 minutes, so everyone, that was good, thanks. By the way, martial law has been declared. He waits afterwards.
Help our students and their families. I've waived interest on all student loans held by federal government agencies, and that will be until further notice.
I mean, okay. I mean, it's just like the federal student loan interest rate. It's not even 3%, but that'll save some. I mean, that'll save some money. Okay. All right. I won't. I don't know how this fits in with the broader plan, but okay. All right.
That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars.
Billions and billions of dollars.
Further.
Nintendo's going down.
Wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit. So
just to clarify, when he says energy independent, what he's saying is that our exports and imports match each other fiscally or exceed in our favor. Whereas what energy independent actually means is that we don't get energy from anywhere else, that we are able to produce it and sustain it entirely within our own country, which we do not do and cannot do at this time.
We're going to fill it up. There's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please.
Oh, please. Oh, absolutely. Bring it in.
Thank you, Mr. President. It is, this day should be an inspiration to every American. Because thanks to you,
I too aspire to be as good a citizen as the CEOs of Target, Walmart, Raid Shadow Legends, and everyone else who just got paraded in front of this fucking presidential address.
your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus, we're bringing an all of America approach.
Okay.
Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories. South Korea and Italy. We
defunded the CDC, claimed it was all a hoax, dismantled the pandemic team, lied about the extent to which coronavirus was a threat to the U.S., backtrack than what your CDC advisor told you. Yeah.
All travelers from all airports in both of those countries. And on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you've put the health of America first, but you brought the best of America to a...
This, by the way, is the true nature of the cuckoldry of fascism. Mike Pence is himself a very powerful and influential person, but he knows that all of his power stems from the cult of personality around his leader, so all he can do while standing there is massage Trump's ego, because he knows that behind the scenes, Trump's ego is the #1 fucking driving force behind everything that comes out of the White House. That's all he can do. All he can do is get up there and choke on Trump's cock, because to mention something new is to implicitly suggest Trump did not himself do a perfect job, which is to get yelled at next time he goes behind the fucking bay doors behind him.
Address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued broad guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been in continuous contact, as you said, with governors around the country. And Mr. President, you have forged a seamless partnership
Jesus Christ.
with every state and territory in this country to put the health. The evening.
Okay, I don't care. Dude, holy shit, dude.
About visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President.
Damn, should have funded the health care.
Difference. So I'm saying that every American should, together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Thank you. Seba, where's Seba? I'd like you to maybe take that a step further, please, on nursing homes. Thanks.
Thank you.
Who's this?
Thank you to the President for the declaration. It allows my agency, CMS, that runs Medicare and Medicaid and has oversight of all of the nation's healthcare facilities, to suspend regulations that could get in the way of treating patients during this time. These temporary national blanket waivers are reserved for the rarest of circumstances, and they represent a massive mobilization of our country's resources to combat this terrible virus. And the flexibilities we are offering will be a godsend to the providers, clinicians, and facilities on the front lines of this fight. And later, CMS is going to be issuing guidance directing nursing homes to temporarily restrict all visitors and non-essential personnel, with a few exceptions such as end-of-life situations. We fully appreciate that this
do we have a
measure
wiki article on
represents
this
a
person?
severe trial for residents of nursing homes and those who love them. But we are doing what we must to protect our vulnerable elderly. Thank you.
As I said in my address to the nation the other night, all Americans have a role to play in defeating this virus. Our most effective weapon right now is to limit the damage.
All right, I found her. Fuck you. Let's see. Serving in the Trump administration, was founder and previously CEO of SVC, a health policy consulting firm. Damn! I love that rent-seeking behavior. Just make everyone in government somebody who was formerly a leader of a private business. I'm sure she didn't have any friends in that business who would appreciate her policies being changed to make her former friends more money. Then she gets to retire and have a consultant job for $1.2 million a year for the rest of her life after she's done being the CMS leader. Vice President for the Health and Hospital Corporation of Marion County. Health officials founded her health policy consulting firm, SVC Inc., in 2001. Work with the implementation of the Affordable Care Act, design of Medicaid expansion programs, develop Medicaid reform programs. Let's see, implemented the 1,115 waiver, managed care. In 2014, concerns were raised over a potential conflict of interest arising from Verma's dual roles as both a healthcare consultant for Indiana and an employee of a Hewlett-Packard division that is among Indiana's largest Medicaid vendors. As of 2014, SVC Incorporated had been awarded over $3.5 million in Indiana state contracts, while Verma was concurrently employed with Hewlett-Packard, earning over $1 million during a period when the company had secured $500 million in state contracts. And then, of course, Trump nominates her because she has demonstrated proficiency in leeching money off of the government to the benefit of private employers. Ooh, controversy. In her role as CMS admin, Verma approved communications subcontracts worth more than $2 million of taxpayer funds on Republican-connected communication consultants and other expenses to boost her visibility and public image. Included were proposals to have Verma featured in magazines like Glamour and have her invited to prestigious events like the Kennedy Honors to increase her public persona. What a ambitious bitch, dude. Holy fuck. Rent-seeking behavior, and then she diverts taxpayer dollars towards her getting in fucking Glamour or going to fucking events so she can live it up as a glitzy fucking Washington socialite? Jesus Christ.
Damage to our people and our country and slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus, reducing its spread, and shortening the duration of the pandemic, which is what it is. The CDC has published guidelines on the coronavirus.gov to enable its coronavirus.gov, and it's very heavily used right now, I will say.
What are you saying?
To enable every American to respond to this epidemic and to protect themselves, their families, and their communities. While the risks to young and healthy Americans remains very low, we've learned a lot about this over the last 2 weeks. Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions and those who are most at risk. They have not done very well. Older Americans who are, especially if they have a health problem.
They haven't done well? I guess that's a way of saying they'll die, but okay.
Done well. We must take all precautions and be responsible.
He's so bored. He's bored. He's a little baby. He wants to go to the bathroom. He can barely read the shit that's in front of him. Very underlying Americans, very bad. He can't.
For the actions that we take and that we see other people take, we want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, by that.
So many great sports of the world?
Problems could be caused. But this is why I outlined on Wednesday night my administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to. We need to be consistent in adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go. You have some hot spots throughout the world right now that people would have never thought possible, and they're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools, and we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC on these common sense measures. A lot of it's common sense. For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions, and sporting events, stagger recess and lunch for schools that aren't canceled, limit in-person meetings, increase scheduled cleanings, and cancel work, sponsored travel, among numerous other steps that can be taken. Americans are the strongest and most resilient people on earth. And in the coming weeks, we will all have to make changes and sacrifices.
Are we
but these
wrapping up?
Short-term sacrifices will produce long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse, it could get worse. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through, in interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term.
What?
In times of hardship, the true character of America always shines through. We live in the company of the greatest heroes and the most inspiring citizens anywhere in the world.
Did he just say we live in the company?
In the company of the greatest heroes and the most
in the company of. Okay.
inspiring citizens anywhere in the world. We want to take care of our people. We want to draw on the strength of our history, draw on the strength of our people, and we will get through this all together. We will just get through it. So much progress has already been made. And frankly, the numbers, because of steps that have been taken, are at a level that a lot of people are surprised.
This is extraordinary. How the fuck can you talk for so long and say so little? I thought Trump wasn't supposed to be a career politician. Jesus Christ. Is this a genetic thing? Fucking move on.
And they do.
I want to ask another question, if you let me.
Oh no, there's a questionnaire segment? Oh God, oh fuck, okay.
And also so much, Mr. President. I want to know if you are in contact with the Brazilian President Bolsonaro after a member of his delegation who was with you Saturday was tested positive. And also, I want to ask another question, if you let me. Senators Lindsey Graham and also Senator Rick Scott are self-isolating. Are you planning to take any kind of precautionary measure to protect you and also your staff who was there with him?
We have no symptoms whatsoever. And we had a great meeting with the president of Brazil, Bolsonaro, great guy, very tremendous. He's doing a fantastic job for Brazil. And as you know, he tested negative, meaning nothing wrong this morning, and we got that word too. Because we did have dinner with him. We were sitting next to each other for a long period of time.
But are you in contact with him over the coronavirus crisis?
We're talking about it country to country, but we did discuss if he had a problem. It was reported that he may have it, and he doesn't, fortunately.
So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all, because we were given a set of circumstances, and we were given rules, regulations, and specifications from.
Coronavirus is a Democratic hoax, folks. It's not real. They're just trying to get me impeached again. It's all fake.
A different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. And what we've done is redesigned it very quickly with the help of the people behind me. And we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night. And this will start very quickly. And we'll have the ability to do in the millions over a very,
billions
very
of tests.
So no, and what we have done, and we are going to be leaving a very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody. And frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers. Tony, maybe you'd like to say something.
Will you have,
Tony,
yes, please, by Sunday
Mm-hmm.
night, will every American be able to get a test?
So just to reiterate what I said to many of you multiple times, it's a descent of a system. The system was not designed for what it was designed for. It worked very well. The CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
Mr. President,
And
with respect,
interestingly, if
you've
you
been-
go back, please, if you go back to the swine flu,
He can't do it. He can't answer a question. Well, if I could bring us back to Obama for a moment.
it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people.
Coronavirus has already done orders of magnitude more damage to the economy and to our country than the swine flu ever did. And the swine flu did not do what he said it, though. The swine flu did not kill 14,000 people in this country. Hold on. Swine flu, America, death toll. (2019) pandemic. The most I can get in confirmed deaths for all of the states is 3,433.
And they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early, and we've also kept a lot of people out.
Mr. President,
yes,
the
please, go
last
ahead.
administration
Please.
said that they had tested 1 million people at this point. You've been
Well, ask them
president
how
for
they did with the
3
swine
years.
flu. It was a disaster.
That's the
Next,
last.
please. Next, please.
It's just what the she's like, wait, we're fact checking you. The last administration said, and he's too stupid to realize that the last administration means Obama and means the swine flu. Ask them about swine flu. No, yeah, the last administration.
They had a very big failure with swine flu. A very big failure.
President, I want to ask you about the European travel ban that goes into effect at midnight tonight and the exemption that you've offered to the UK. There are 17 countries that are in the so-called Schengen zone that have fewer coronavirus cases than the UK. And just in the past 24 hours, the UK has added 208 coronavirus.
Yeah, back in 2009, the first case of swine flu was reported on April 15th, and the government declared it a public health emergency 11 days later. Coronavirus has been in America for more than a month.
Cases to their total. Why do they, Mr. President, deserve an exemption? And would you consider adding them to this travel ban list?
Well, that was recommended to me by a group of professionals, and we are looking at it based on the new numbers that are coming out, and we may have to include them in the list of countries that we will.
The only reason you didn't is because you're buddies with Boris. That's literally the only reason, guys. The rest of Europe gets put on a travel ban, but the UK, which is doing worse than like almost any other country in Europe except for maybe Italy, it gets kept off the ban list. That's it. That's it. That's the only reason why. Because he doesn't want to embarrass Boris.
You could say ban or whatever it is during this period of time. But yeah, the numbers have gone up fairly precipitously over the last 24 hours.
Ooh, that's a big word.
We may be adding that. And we may be adding a couple of others. And we may frankly start thinking about taking some off. Go ahead.
Thank you, Mr. President. I'm a correspondent with Hong Kong Phoenix TV. You have mentioned that the number in China has been decreasing. China has made tremendous progress in the past weeks.
True.
I'm wondering how much confidence does this give you to control the virus in the United States? And do you see the data China has been sharing with the United States has been helpful?
I think it has been helpful. We've been working very much with China. I've spoken, as you know, with President Xi. They went through hell, and their numbers are starting to look very good. They're really looking very good. We're very happy about that. We are sharing data, yes. In fact, we're sharing quite a bit of data.
Somebody should let Ben Shapiro know, who apparently still believes that China has done a horrible job containing the coronavirus. You remember from earlier in the stream when he was talking with the caller and they were like, "Oh yeah, China's done terribly." You know, you remember? I remember.
Including the fact that some of our pharmaceutical companies are working over there right now with large groups of people. Yeah, go ahead, please.
Thank you, Mr. President. You spoke with Canadian Prime Minister Trudeau yesterday.
Yes,
Did you discuss the potential closing of the border between Canada and the U.S.? And by extension, are you considering ways to salvage the $2 billion daily trade between the two countries?
So we didn't discuss the border. We've had a very good relationship, just about finished with the USMCA, as you know. He called me to tell me that. I think that was the primary reason for the call. At the time, his wife had not been diagnosed, and she's a lovely lady, wonderful lady, great lady. And since then, I've read that the result was that she has it. And I was a little surprised. I think he was surprised also. We did discuss it prior to. She's going to be fine, but he thought that she would not most likely have the virus.
Cool.
Unfortunately, she does. But we didn't discuss the border yesterday, no. Go ahead, please. If you have any questions for these great geniuses up here, you should, even a business question related to what we're talking about.
Mr. President, Tom Colombo from ABC News Miami. As a relatively new Floridian, what is your message today to the cruise line industry and the travel industry that Florida depends upon? And since Senator Rick Scott and Miami-Dade Mayor Carlos Jimenez have the same exposure as you and they are self-isolating, what's your message to them that they shouldn't be?
Well, I don't know that I had exposure, but I don't have any of the symptoms. And we do have a White House doctor, and I should say many White House doctors, frankly. And I asked them that same question, and they said, you don't have any symptoms whatsoever. And we don't want people without symptoms to go and do the test. The test is not insignificant. As far as the cruise line business, we're with them all the way. It's a great business. It's a great U.S. business, frankly. And I know.
I don't remember all of the details on this, and I don't want to embarrass myself by speaking half-truths. But wasn't there recently a cruise liner that caught corona, and they ended up containing everything on the cruise liner and not letting anyone off, and it basically guaranteed that everyone on there ended up getting infected? So, like, the number of infections just, like, skyrocketed? Yeah, the Diamond Princess. Yeah, that's right. The industry is terrible, folks. The cruise industry, it's bad on the worst days, but in a fucking pandemic? Christ.
How important they are to the country. That includes airlines, but the cruise line business obviously was hit very hard. We had a tremendous success out in Oakland where we moved it. Vice President Pence did a fantastic job with that. We worked with UK, we worked with Canada. They took their people back in Canada. It was approximately 600 people. UK likewise took a large number of people back to the United Kingdom. And we have people quarantined. It was a big operation, and it worked out really, you don't hear about it anymore. It worked out really well. Mike, you may even want to say something about that, because that was really done properly.
Please get me away from this
thank
mic.
you, Mr. President. And
fuck
for
off.
doing that.
As the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now to ramp up production of respirators and that kind of equipment should this outbreak persist?
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible.
For my own sanity, folks. For my own fucking sanity. I think we know how the rest of this is going to go. People are going to ask questions, and Trump is going to hand them off to somebody else so they can provide a non-answer. Except for this lady. I like this lady.
You can learn and I appreciate there was some graphics done by some of the reporting over the last several days.
You did a graphic. You gave us a chart. I like her. She gave me a chart.
Robust.
With other countries and learning from the lessons that they already suffer the same situation.
Yeah.
Countries, of course, like China and South Korea, but now recently
Sure.
Italy and Spain.
Well,
and
Italy's
how is
having
that
a-
coordination done?
Italy
Thank you
is
so
having
much,
a
Mr.
very, we're in touch with Italy, and it's a country that we love. We have tremendous.
It just can't answer anything. There's only so much content I can milk out of Trump brain dead. Dumb. There's only so much content that I can milk out of this. I'm really sorry, guys. Okay, God help me. God almighty. Fucking Jesus Christ. Fucking ad space sold in our national emergency preparedness. God.